Well, hi everyone. This is Dalal, and welcome to our first episode of Behind the Revenue. This is the new series is all about the conversation that we'll be having with the healthcare providers on the healthcare executive, what exactly they have faced and happens after starting their practice, especially in the side of revenue and the business. What does this make sense? Today, I have joined by Dr. Leon, and it's a pleasure. Thank you so much for taking out your time and joining me. I'm looking forward to hearing more about the journey, the reality on the side of behind the running the practice. Because we usually learn more about revenue cycle. It's more about today to learn exactly what happens behind the show when you're just starting up the practice, what you need, all of those things. Thank you so much for joining me.
Okay. Well, let me start by introducing myself. As Mohammed said, my name is Dr. Cloud. I'm a retired podiatrist, retired as of 2019. We'll be coming back online as of next year. But in the meantime, I consult with people like Mohammed to talk about ways in which I can add my personal experience of being 20 plus years in the medical profession, how to do things the right way and get your practice going and make it successful.
Thank you, doctor. Thank you
Welcome.
so much for the introduction. So, doctor, I'm gonna ask you with this basic questions. What was your expectations when you started the practice, the first reality check that you faced?
Well, when you start out in practice, especially when you're staring at your student loans and going, oh my God, what the heck have I done? I have this huge debt over my head, and now I have to figure out how to make this work. So when you start out, you always feel like you'll never see enough patients, you'll never make enough money. And then in the first year of practice, lo and behold, magically, somehow, all these patients start to appear and you start making money. Where your ground game really comes into play is making sure that you are set up properly so that you can capture everything that you are entitled to uh, revenue, generate revenue from the practice. So Muhammad will come in and teach you everything that you need to know to make sure that you're getting that, setting up the practice correctly, making sure that you are credentialed with every insurance that you can under the sun. The more insurances that you get credentialed under, the better your chances are of having more patients that you can see. You also want to make sure that you are set up properly from the standpoint of the insurance and taxes to make sure that you're in the right kind of tax situation in terms of do you want to be a corporation, an LLC, and this is something that Mohammed can work with your accountant to help figure out the best scenario forward. But the point is a good practice starts with a good, solid foundation. And Mohammed is your foundation that will help make your practice grow and grow the right way.
That's so kind of you, doctor. You always say some good words about us, and that means a lot. Doctor, what was the biggest, I would say, challenges that you ever faced? Like, when you started this, and was you were like so fortunate to have a right biller on your end, or you have to set up everything by your own initially as a provider? What was because we usually meet those provider when they're struggling,
Right.
unfortunately. So, how that goes with the
It's
individual provider when they get out of school and how it goes.
you come out of a program and you think you understand the system, and then day one hits when you open your doors and you realize they gave you just enough to know how to get started, but not enough to know how to run a practice, which is like 50% of the practice is front office, back office. Medical school gave you a bunch of stuff to sort of get going on the front office, but they gave you nothing of how to
Mm-hmm.
handle back office. So in terms of back office, what do I mean? Um, I can tell you that it's 20 to 30 times in the first 30 days of practice, I would call my biller every day to say, will this scenario fit this rule in Medicare? Will this patient be covered
Mm-hmm.
under this situation? Because you'll have 1,000 of those weird questions that don't automatically fit perfectly into one category. And that's where a biller such as Mohammed will come in and be your sage to tell you if this is correct, if you can do this, and if you will get paid on doing this.
Mm-hmm.
I would literally trust my biller to say, if the biller says go, then we go. If the biller says no go,
Mm-hmm.
it ain't. No, it's a no go and it's a non-starter.
Mm-hmm.
So
And do
the
you
biller
prefer
is
to?
really important. Go ahead.
Thank you, Doc. So, do you prefer to go with, like, for example, most of the practices started up recently, or they would just, wanted to start their practice. Most of them then think that, we don't want insurance right now. We will go on just cash, and they, because majority of
No,
the
go
people
ahead.
have the insurances. So, what's your thoughts on that?
The a cash practice in the ideal world is very nice because it's
Hmm.
instant revenue. Um, you know right away what you're getting. On the downside,
Hmm.
people really don't like paying cash because
True.
if you have a scenario where you don't know walking into a visit, are you going to be $200 or are you going to be $20,000 of work? That's the point of having
Hmm.
insurance and getting properly paid from the insurance to cover those variabilities in a typical practice, which you honestly won't know about until you start diving in, because each
Certainly.
practice is unique, different, and one doctor will set up their practice one way and another doctor will set up completely different, and both of them will be as equally effective.
Hmm.
So it's about customizing the practice to fit your recommendations, your requirements. And Mohammed is
Hmm.
like a sculptor sculpting the practice around you.
Okay. Again, thanks, Doctor. And let me ask you this. So,
Sure.
once you started up, was you fortunate enough to go by with someone who already knew about the industry in terms of revenue cycle, or do you would like to learn things by your own? How was that experience?
I think it's a combination of those two things. On the one hand, you do want to learn and learn as much as you can because the more knowledge you
Hmm.
have, the more it'll help with your patient care, with being able to make sure that you can do what you need to do, whether you're in somebody else's practice or off on your own. Before you start,
Hmm.
you do need to know the rules. To know the rules, you need to
Hmm.
have somebody who is an expert in the rules to help guide
Right.
you into that.
Right.
Because once you know the rules, you need to come back. The rules change all the time. You have
All the time.
Medicare, which is the national provider, writing one set of rules, and then you'll have someone like in our location, Meridian, which will write rules on top
True.
of those rules to explain those rules, which will completely change the rules, and those could change quarterly. So
Exactly.
yeah, I like to have someone around that can read and keep up on that stuff because I don't like spending my time having to do it because I have enough to do making sure that my patients are well cared for. That's why we
True,
trust people
Doctor.
like
True. I myself, prefer, and I always say this, that providers read in the medical school for 2 decades. They should supposed to actually do what exactly they learned over there, right? That's treating the patients, and that's their,
right,
their passion is all about. That's what they learned, and that's what they can diagnose, right? They cannot just go and write the
right,
CPDs, learn more the ICDs out there, the LCDs by, and then the NCDs for the national coverage determination, all those things which are actually for a provider, it's a new whole world out there. So
oh, don't even get me
uh
started on that. I mean, I'm going to interrupt you for 1 second. When you brought that
sure.
one up in particular, as an example, this year, going from 2025 to 2026, reimbursements for example, in the wound care space dropped
Sure.
90%.
Certainly.
So knowing to talk to your bill on a regular basis to know how to pivot around a 90% reduction in revenue and still have a
Hmm.
viable practice is huge. And that's where a good biller will help guide you and say, well, you had this scenario. Now you need to throw that model of practice out
Hmm.
altogether, and I'll come up with a brand new model that will help take care of your patients, but at the same time give you new guidelines to follow because all your guidelines were based on old Medicare rules on billing,
Hmm.
and now those don't work anymore. So now you have to come up with new rules. Is the whole point, and that's where an expert will help guide you to that, and then be there to help support you as the rules change, so that you can. You should always be an expert in knowing what to know, but at the same time realize those limitations, and that's where the biller comes in to help fill in all those extra details. You want to be able not to hand your entire practice over to a biller because you want to be able to always keep an eye on what the biller is doing, but at the same time,
Hmm.
there's day-to-day stuff that happens all the time. You have to call back insurances when there's a
Hmm.
discrepancy. You have to check IVRs. There's constant flow that goes with keeping bills moving, and that's a whole separate entity. Hence the reason why there's a RevMedics in the world.
Certainly, doctor. And IVR is something that we're talking about. So let's just talk about how we you handle your front desk when you started everything. Because nowadays, I have seen a lot of troubles in terms of eligibilities. The front desk is not scheduling issues, confirmation calls issues, all of the stuff. How that was with
Right.
you?
Well, with me, I'm a little bit of a unique situation. Um, I was a solo practitioner who ran an entire practice on my own. I don't ever recommend doing that because
Hmm.
that is way too much for one person to handle.
Exactly.
That's where you start um, delegating tasks, especially those tasks which is not really your purview to be working in, such as figuring out how
True.
much to charge a patient. Um, Also, that
Hmm.
brings up another reason of why to have a biller. You don't have any clue what other people are doing in the community. A biller is really
True.
a also it's like a news reporter telling you what your competition is doing in terms of how much to charge because you have no clue when you start out how much to charge. It could be $50, it could be
Hmm.
$200. You have no idea, and that's where a biller comes in to be your guidepost to say this is how much the community is charging right now. You want to stick to somewhere in that area.
Exactly. And I think now since the scrutiny has been so much intense, everybody and now the insurance wants your documentations, the progress notes needs to be accurate. And
Right.
that's just something which is everything is based on that right now. So they're not just want you to write CPDs and say, hey, this is the bill, pay us. Insurance just doesn't like to pay. I always say this that they get paid to not pay the doctors, right?
Correct.
Whereas we get paid to collect everything for the doctor. So the thing has been changed. I think it's good to have like a biller or expert on your side once you even first of all once you're starting up. I think at the most you need someone that you can guide rely on who can guide you about the compliance of the state, those see the diagnosis that you need to put in, the progress, how you write the notes over there, because you can do it by yourself, but again you need someone who can actually guide you first of all for first few weeks to see how it goes, and then update it by the time and let you know that this is even the procedures. If you in terms of wound care, if you have to do a procedure which is grafting or skin grafts, substitutes, and all this stuff, you need to make sure that your document should speak it by that self. Otherwise you will be getting denials, you getting rejections, less payments, all those issues. Have you ever faced those kind of issues?
Oh, all the time. I mean, when you get into a situation where they're asking for additional document review or the
Hmm.
dreaded words ADR, ooh, that's the one that sends a shiver down your spine because that's the one where they want piles upon piles of paperwork to justify
True.
what you already know
True.
that you did correctly. And it's a
Hmm.
huge hassle, a huge pain in the butt. But it's something where, once again, a good biller will help make sure that you stay on task, get all your stuff in on time, will help generate reports for you to help make sure that you are
Exactly.
getting paid. You are the
Definitely.
bank, without a question.
Definitely. Definitely. You're spot on that because obviously the provider doesn't know that even if I need the pre-authorization for that procedure, because those are state regulations, you should supposed to tell your provider by yourself. And then again, what to write when you're billing those procedures out. Otherwise, you get the denials, all of those things, and the payments. The whole process will take its time, but again, it's good to have a right person on your end. Have you ever occurred or you faced this challenge that your first time starting up and you might got into a wrong foot with somebody, let's just say a wrong biller or wrong
Oh, yeah.
coder, and then you switched to another firm? Because obviously I would say individual billers who are just working on one practice are good, but again, if you connect with someone who has an expertise of different specialities or someone who's dedicatedly working on something like considering it's yours, because I always say this, the value mindset needs to be there as a biller, because they will actually consider your practice as their own work and bread and butter, and put a lot of efforts to read before they just do something blindly.
I do agree with you. And also, there was something else I was going to talk about with you. Um, yeah, I forgot already. Pardon me for swearing. What I was going to say is also with a biller too. When you're building a practice from the ground up, you have a lot of capital equipment purchases. And every piece of capital equipment, if it links to a CPT code, you better believe you want to make sure before you purchase that, well, you actually get
Certainly.
paid for the work that you do on that machine. So, yeah, the
True.
biller is indispensable on every choice you make. Just like your CPA is indispensable on your financial future, your biller is the CPA to the financial health of your practice. That's the
Certainly.
easiest way
No,
to describe it.
no doubt, no doubt. And then obviously the billers out there right now in the States, since they know it's a good business, some of them are still keeping it reasonable for the new providers. Some of them doesn't really care about that, and they are charging them, I would say, not a competitive percentage, but somewhere about 10, 15, 20. That's what I heard so far. And even the right now the agencies out there who are just, even though they are new, they don't have a lot of testimonials, or they are not so much competitive, but still they're, because of they are in the market, they are charging a huge amount of percentage, flat rates to the providers. I think that's actually cut their half bread and butter, because they're starting up, they need the capital, they need someone who can help them out to build everything from the ground. What's your thought was on that, like how it should supposed to be?
Well, right, right. What I really appreciated was the fact that there was a percentage model out there when I first started out, because when you
Hmm.
start out, you're actually in the hole, and then you're in the hole deep. When
True.
I started out, I think, on student loans, I was almost up to 400,000.
Hmm.
So to have a $400,000 debt sitting over your head as you're trying to get a practice
Hmm.
going, you really do want to hold on to capital because you have no capital when you start. So a
True.
percentage is always the way to go, in my opinion. But yeah, there's definitely a difference in somebody that will charge you one percentage over another. So what I really look to is, what will that person be able to provide? What kind of experience do they have?
Hmm.
How creative are they in terms of how they look at billing? One biller will look and read it verbatim. This is how it is written, therefore this is how it needs to be done. But then there's more room for interpretation in billing that people understand. For example, my favorite one
True.
that I always love to use is Medicare at one point decided, for whatever reason, that they wanted to get rid of debridement of calluses, 11055, 11056. And
Hmm.
there's an expression that I use all the time. Whenever insurances try to save money, it always will cost them more. And in this case,
True.
it worked out just exactly like that, because everyone then said, well, if we're not going to call them calluses anymore, now we'll call them calloused lesions. And if you call them calloused lesions, now they qualify under 11040, which costs more for the insurance to
Right.
pay for. The point
Small
is a
difference.
good
Yep.
biller will know all those little tiny tweaks that you can do of how to move, because the system is not set in stone. These laws are all interpretations that were written by people that interpreted how the interpretations were interpreted. So having
True.
someone to digest all that gobbledygook and be able to give you a real honest answer of how to proceed forward and how
True.
to do it so that you and the biller can stay in practice and help the patients get better, which is the ultimate goal here.
Indeed, indeed, because obviously a doctor, I believe, a provider cannot do a lot of these things because they have to treat the patients, right? They are already spending a lot of their hours in that, so they cannot just do that, right? You cannot expect a doctor to do a lot of things. It's always to have a right partner on
I,
your side who can actually take care of everything.
correct. Or just to think of it this way, you have in your day a typical 40-hour work week. I can definitely tell you that when I was in practice full time, it was
Hmm.
literally time and a half. I was working probably 60 to 70 hours a week. On a 60 to 70-hour a week schedule, you have zero time to call back billers. You have zero time to figure out the difference between an 11055 and an 11040. This
True.
is where spot calls to your biller will help clarify and get your answers quickly so that you can focus on patient care, which is your number one goal.
I understand perfectly. Now, what would you say your advice? Because and what was the first the mistake that you have done when you started out, and now good
Right.
advice for the new provider, especially for the news who were just coming out of this med school now, and they wanted to make a change for themselves. They wanted to help out the people. What should supposed to they look for?
First thing you want to look for is make a decision pretty quickly about whether you're going to go into solo practice or whether you're going to go into a group practice with somebody else. And those two
Mhm.
decisions will greatly determine how you proceed forward. Um, a solo practice, you collect 100% of the revenue yourself. It is a lot more risky
Mm.
than being in a group practice because in group practice, you have a whole entity around you to protect you.
Exactly.
So that means that if
Exactly.
you're solo, you're doing a lot more on your own. And if you're solo, without a doubt, you want to have a biller because you are going to be inundated with everything that a normal practice would do. They would have a secretary, they would have a back office nurse, they would have the doctor, and they would have a physical location where you could see patients. All those
Mhm.
together means you're spending less time having to deal with the mechanics of getting to the patient and treating the patient and just focusing more on treating the patient. So if you're going that route, yes, biller. But even if you're not going that route and you're going into a group practice, you still want to think very much about, is a group practice going to be a good fit for you? Um, when I started out, I went first into a group practice, and I had some both good experiences and some
Mhm.
horrible experiences. Bad experiences was
Mhm.
not taking the time to visit the practice first before making a decision if I wanted to be part of the practice. Always do that first because
Mhm.
you'll be surprised rather quickly um, what the political makeup of the practice is. I've had experiences where I've gone in and had um, practices that were less than scrupulous and left those practices right away. But then
Mhm.
that also burned time, in which I could be generating revenue properly. So make sure that you take the time and if you go into a group, investigate them fully before you make a decision. But my preference, if I was in your shoes, don't waste your time doing a group because when you go into a group, unless it's a group where you're a partner in the group, it's not really worth your time because
Mhm.
when you come out, it's all about building your brand. You're the product.
True.
You're the one that we want to have the best success possible because when you're successful, everyone around you is successful and that makes everyone happy.
Certainly.
So the goal is you really, if you have a choice between solo or group, my preference, I would say go solo. Don't go group because when you go group where you're a W-2 and you're not a 1099, you yes, you
Mhm.
gain all these niceties. Someone will pay for your malpractice insurance. Somebody will help pay for your capital expense for tools. Somebody will help pay for you still there?
Yeah, I'm here. Doctor, can you hear me? Sorry about that glitch. Now, doctor, you were saying.
Okay. If it would be helpful if you could refresh me where we were in the middle of the conversation.
Certainly. We were just asking, telling about the group practice, or either should they join the go via solo, and the pros and
Okay.
cons, everything
Okay.
of that.
Right. So I mean the basic thing with solo practice is you got to remember that a group practice when you start out is nice, but you're gonna eventually everyone always will pivot to their own practice. So the quicker you can pivot to your own thing, the better. So that comes back again to making sure that you're set up properly when you start out. So if I was you starting out in practice, I would actually go solo and then fill in on the side with a little bit of moonlighting from a group practice. That would just be my way to
Certainly.
handle that.
Indeed. And then obviously, if you start your
But
own
yeah,
practice,
no,
you can layer on. Yeah. I was just saying, you can start with solo, and then you can add more providers to your own practice, make it your own group, become an owner,
right.
to make earn the good amount of revenue at the same time. And if you would like to have a group practice, just make it, for yourself.
And also the reality is that if you go off into someone else's group practice, they're not going to give you patients. That's just the
Hmm.
reality. The reality is
True.
they're just giving you a home to roost it. You still are acting like a solo practitioner in a group practice. So you're doing all the work to generate all the money for somebody else's practice. When in reality, you should be doing that for your own practice. That's why
Certainly.
you go solo and don't join a group as a W-2.
Totally agree on that because what I've seen so far is, the providers who get out of this, medical school wanted to do some good. They're very, enthusiastic about everything. They want to do things, one by one and again. At that, at that age and at the peak of your career, I believe it's good to make some right choices, do good for yourself, and retire in a very happy, peaceful manner. That's what you all need to do.
I'm
And
going to I'm going to
sure.
one more thing. I apologize for interrupting you. Stay away from trends. You'll see everyone under the sun, as soon as you come out of school, will approach you and say, buy this capital piece of equipment. It'll make you so much money. It'll be fabulous for your practice. And then somebody else will say, no, you should go and get this little piece of equipment and you'll make great money. And the reality is they're
Hmm.
all trends and fads. You have to figure out in your
True.
lane or your little area of practicing, what is your bread and butter patients that are constantly coming through the door to see you. Those are the patients you want to focus in on. Those are the patients you want to develop a good billing practice plan with Mohammed to make sure that you capture that. But you want to be able avoid the mistakes I made when I started out was go like everybody else. You go after the trends. The latest trend right now in my sphere is amniotic tissue grafting, and everyone like crazy was
Hmm.
jumping all over this. And then reimbursements,
Hmm.
and now everyone that was relying on those reimbursements as always being there are now shutting their doors, and you're seeing tons of wound care practices that are leaving the state because of pick a lane that will give you consistent results all the time. And then add the fun stuff, the wound care, or if you're in a general practice, doing labs or anything that is something that would be something that makes you stand out. Because those will not sustain a practice. They won't give you a good, solid foundation like bread and butter patients. In podiatry, bread and butter patients are cutting of nails and painting that pay regularly. In internal medicine, those kind of patients are patients that come in for their annual physicals or their monthly physicals. Those are
True.
patients that are dependable and will always come in and will always see you. Those are the patients you want to focus in on. Those are the patients you want to grab because those patients build a solid foundation to your practice. Then you can add on all the fun stuff, all the surgeries that you want, or all the fun studies that you want to do. But always remember, stick to the fundamentals. Make sure that you have a good, solid foundation. That's what I would do.
Exactly. That says a lot because, if you have a good foundation, the building can stay there for the longer run. So that's what you need to build up when you're starting up.
That's the name of the game in medicine. Those that can stay around the longest make the most amount of money.
Certainly, doctor. Again, you have ton of knowledge, and we can just, I believe, go on and on for this. And but still, we have a podcast to shoot, and we
You need to have someone like a Mohammed in your life to help you steer in a new practice. I would love for you to come on and share your experience and tell me. We would love to hear about how you've done in your practice and what words of wisdom you can offer to new practitioners that are starting out and are getting going.
again, thank you so much, doctor, for your time, and hopefully we'll be having more journeys with us, more stories, more challenges, more difficulties that we ever get ahead, and let's just hear them out, fix them up, and make it easier for everybody. Thanks, doctor. Thank you so much for joining in. You have a great one.
You too.
Bye.